Hi, everybody. This is Dr. Sadler with Creating Future Nurses. And today I have with me Mr. Paul Lieber, who is the Vice President of Operations for Westview Healthy Living. So thank you, Mr. Lieber, for joining us today. How are you?
I'm doing well. Thank you for inviting me. I appreciate it.
Good, good. So can you tell us a little bit about yourself and what you do for healthy living?
I've been in long-term care for 30 years. I started in 1992. I've traveled. Most of my career has been in Pennsylvania as a regional director of operations, and my last position was the vice president of operations for JDK Management. Then I came back to Ohio. At Westview Healthy Living, I'm in charge of the long-term care post-acute facility. I'm also in charge of the assisted living and all the operations and financial operations, clinical operations. So anything on the campus, I'm kind of responsible for. So that's kind of my role here at Westview. So.
Okay. Wow. That sounds like a big job there.
I'm doing a long time. So yeah, there's a lot to know. So with surveys and staffing and all that, yep, it's a lot to manage.
Okay. Wonderful. Wonderful. So I know you have a special background when it comes to nurses and have some special relationships with some nurses in your past. Can you share with us about that?
Sure. On May 16th, 1991, I was driving back from Cleveland, Ohio. At about 9:30 at night, I stopped to help a guy push his car off of the road. And I was behind the car pushing. And a little bit later, a drunk driver smashed me between both cars at 45 miles an hour. Fortunately, there was a nurse 2 cars behind, and she stopped to help me and stabilize me, and obviously the paramedics. Excuse me. So that I call her nurse number 1. And then when I got to the emergency room, there was obviously a group of nurses that helped stabilize me to life flight me up to Metro Hospital in Cleveland. I affectionately call them nurse number 2. And then there was also a nurse in the helicopter who was very kind and just loving on the way up to Cleveland. And I remember that conversation very vividly because I was in the helicopter being life flighted up to Cleveland. And I affectionately call her nurse number 3. And when I got to Metro, obviously they took me into the surgeries and to rebuild my legs and do a lot of medical things. But probably the most important nurse and why I have so much reverence for nursing and just a sacred field to me is the nurse that when I got into a room and through a lot of surgeries, I went to therapy and I couldn't lift a wooden cane over my head and I just broke down. And it took me about an hour to get back up to my room. And there was a person in the room and I know very well he was probably off the clock. And he sat and talked to me for probably about an hour. And to this day, that's probably the most difficult conversation I've ever had with anyone in my life. And he basically said, you can get up and walk or you can live in a wheelchair. It's your decision. And that person's name was Ed, and that was my nurse. Without him building that trust with me, because I knew he had me, I would probably still be in a wheelchair today. And my career has been to give back to nurses just because they're very special people on the planet. And I just have a lot of respect and they're just amazing people that go into nursing. So without them or him, but that's kind of my yardstick for a nurse now is Ed. So anytime I speak to a class, I really want them to be an Ed. You know, can I remember your name 25 years later because of the care you gave me? And I think that's the special bond that I have with nurses, and I will always have it until I'm not here anymore. So they're just great people, and I have a lot of love for them.
So what was it about Ed that actually made you listen to him? Because any nurse could have came in and said that, but
it was really just a private trust level. After surgery, we had a deal that he would let me recover. He made things special, like a shower. I had external fixators and internal fixators and a lot of wires and tubes and but he backed me into a shower and wrapped my legs up and wrapped my port up and said, I don't care if you drain the whole city of Cleveland of hot water, go get a shower. And I know we shower every day and it's not a big deal, but I can remember that. He gave me catheters. He washed my hair in the bed. He just did the little things, but he had that trust with me that I knew he had me. So if I listened to him day in and day out, and it was not easy. It took me a year to learn how to walk again. But I knew he had me. He had that trust. He would come in and talk to me. What's going on? Here's what we're going to do today. Here's what your day is going to look like. This is going to really be bad because I have to do something bad to you. They took the skin off of my thighs and they put zero form, and he had to take that off. And that was not pleasant, but he came in and he was just very honest, very upfront, and really directed the care. Laying in bed, I know he advocated for me in a lot of stuff that I probably wouldn't have gotten if he wasn't my cheerleader and my liaison with the doctors, and he really advocated for me to get better. But it's just really that trust level of just deep interpersonal, just connection with somebody that you know they have you. From the first time he talked to me, I knew if I listened to him, and I struggled with that. If I really listened to him, I knew I would get better because he told me that, and I believed it. And ultimately, that to me is the trust level. And it's hard to get when you're 3 days in the hospital and you're gone. It's hard with healthcare these days because you're not a patient for very long. I got discharged on July 7th, so we had time to build that. But I think that's the key. If a nurse can make that connection quickly and get that trust level, that's the key to that relationship.
Okay. So what about the other nurses that you just had a brief encounter with? So it wasn't as long as your encounter with Ed, but what was it about those other nurses that made them special?
Again, just the caring. They had big hearts, and I know that I was a tough case. They would come in and do pin care, and they would just have a conversation, not about the procedure. It was more of me. Who are you? My story, what happened. There's just a lot of caring there. And even nurses today that I meet just have a huge heart of caring. It's all about the patient, what's going on with them, and how can we help you through today? So it was really just that, again, the trust and the honesty and just the caring. They just have some pure hearts, and that's the other nurses. Again, they did. I remember a guy gave me a catheter, and he said, blow out, and I followed instructions, but he walked me through it. So it's just little stuff you remember, but it meant a lot because they were just talking, and they were, it was a bedside manner. I guess sometimes we lose that, but there really is a person laying in the bed that's a person. So, yeah.
And so how are you today? As far as,
I'm actually very well. Good. Yeah, with my work here, our Westview is a very large campus, so on average I walk maybe 4 miles a day. I still work out every day. So I have no pain. I don't have any. So yeah, I'm really back to normal. So just grateful for going back to the original. If she would have put a tourniquet on my leg, I would have lost both of my legs. But she knew to put pressure behind my knee till the paramedics got there. So it all started at that moment. It was a nurse making the right decision from the get-go. And I think there's a lesson in that too. You have a random person in front of you, and your assessment skills have to be stellar. Because if you blink, something bad might happen. If she blinked, I would have lost both of my legs.
Yeah.
So, to me, that's another important thing that I try to cover is that initial decision may or may not, which path you're going to take. And to me, that's the assessment skills are what I get fascinated at with nurses. Because they can look at random people and, make that call. And it's usually the right call. And that's just amazing skill that you teach. That's just pretty cool.
So, what would you say, or what do you believe is the most important quality for any nurse to possess?
I think just caring. The Rotary has a motto of service above self. And I think if you take that approach of you serving, because we take care of some very sick people. So if you're a servant, you go in and you take care of the patient as they present. But I think service and just the caring heart are the most important attributes for a nurse.
Mm-hmm. And what do you say to those nurses that are still striving to get to that point?
Take the time to listen. That's probably the most critical skill a nurse can have is listen, because people will tell you stuff. I know we live in a very hectic world, and nurses have about 5 minutes to do a med pass and they're out of the room. But if they're struggling with that, I would just say slow down and listen. Take the time to hold somebody's hand and look them in the eye and have a conversation with them. How are you feeling today? How are you doing? And listen. But I think it's just, if they're struggling, I think it's just slowing down and reconnecting with the person.
Okay. So what about Westview Healthy Living? About how many nurses do you have on staff there?
We probably have about 40 nurses on staff, and on our whole campus, we have about 160 patients.
Okay. So what do you look for when you're hiring a nurse?
Again, somebody with the personality, who's listening, who has a caring heart. We can teach you the mechanics of the nurse, the med pass, the tube feeds and the trachs, and that skill can be taught. It's really the person. So we really look at, who are you? We look at, how are you speaking? Do you know medical terms? Do you know, but it's really just the caring heart that we try to vet out during our interview process of, if we put a person in front of you bedside, how are you going to treat that person?
Mm-hmm.
What are your values? What are your morals? What are your ethics? What are your, what drives you to be a nurse? That's my favorite question during an interview. What brought you into nursing?
Mm-hmm.
So it's really the person and the personality that we hire.
That's funny. You said that one thing. Why are you in nursing? Sometimes I have students to say, well, I just needed a stable career.
Yes.
And, nurse, somebody's always going to be sick. So you're always going to need a nurse. What do you think about that?
If you give me a financial answer, then you're in the career for the wrong reason. If I get a people type answer, then I know you're probably in the right field. Or, it is a stable career, but is your heart really in it? Are you just coming in for a paycheck going home because you're going to have a job tomorrow? And nursing is totally an unlimited field to me. You can go anywhere and get a job at any time. But why I get below that, why are you really in nursing? And again, if you're a financial person, I really don't hire you. It's, what is your heart? You're going to be touching people. So what's your drive to do that? So for me, I get below, and it's probably a very quick interview. If you give me a financial answer, I will shut that interview down and move on.
Do you hire new grads?
We do. Yep. And again, we try to teach and have the morals of a nurse. We'll put you with a seasoned nurse to mentor. So we want you to have that good start, and learn and teach, and learn, because it is hard. I mean, if you're not confident, you need help, because everybody started somewhere. Nurses sometimes eat their own, which, is the old cliche. But, can you teach somebody to have, how do you get through a day? How do you get through a heart attack, sending somebody out? Because, you may have a rough day, and how do you deal with that? So it's, but yeah, we try to mentor, teach. What level are you coming in at? So we don't want to throw you in a med surg unit if you're maybe at a lower unit. You're a lower skill set. So we try to start small and work up, so that way you're comfortable and not running out the door screaming because it's too much. So we try to take baby steps, because you could be dealing with a TPN, you could be dealing with a wound vac, you could be dealing with, whatever cases are on the floor that day.
So how long is the orientation process?
We really don't put a time on it. It's really up to the person. Some people catch on quick. If you're a seasoned nurse and you need, 2 weeks, great. If you're a new grad and you need 6 months, okay. We're really not in a sprint here, because we're open 24 hours a day, 7 days a week, day after day after. So if it takes you a little bit longer, so what? My preference is you learn the right way, not rush you through it. So if it takes you a little bit of time, just speak up and say, hey, I'm not ready yet. So then we need to find out what are you not comfortable with, and let's go teach that, or let you practice it until you get comfortable. And then, so we really don't time it. It's really up to the person.
Now, if it is a new grad, should they wait until after they take their NCLEX, or could they potentially be hired with anticipation of
We would hire them right out of school. Yeah, we would hire them pending the NCLEX. So that way we can get you in, you can shadow, you can see what life is on the floor. But we hire new grads before they take the NCLEX, because it might help them study for the NCLEX. So yeah, we would hire prior to the NCLEX.
Okay. So what advice could you offer someone that's either in nursing school or getting ready to graduate nursing school? What's the best advice you could offer someone?
Always keep learning. I mean, I've been doing this 30 years and I'm still learning. A lot of hospitals, long-term care facilities, they offer free education. Please take it. Keep your assessment skills sharp. There's always something new to learn. So keep learning. Because when you get out of nursing school, it doesn't end there. So that would probably be the best advice I could give, other than just never stop advocating for your patient. If you know something's right, say it. Go at it. Be passionate about it. So it's probably the 2 words of wisdom for a nurse. So,
what did you say?
So that's probably my 2 words of wisdom for a nurse is keep your assessment skills sharp and always advocate for your patient. So.
Okay. Well, thank you. That's awesome.
Thank you.
It sounds like a great place to be there, to work there. I know
we try. We're not perfect, but we try. We always try to, some days are a struggle, and, you keep trying. So, but we have a great core group here. They kick in. Even this morning, everybody kicked in on the assisted living side to help pass trays. Even the maintenance or the housekeeping guys, they were passing trays. Just because somebody needed help, and it's just that family here. We do consider us a family, so we do care about you, your husband, your kids. So we do get down to that level with our staff. So yeah.
So you maintain a culture of helping.
Yeah, we're based in the Brethren religion. We have a deep religious background here. We have a pastor on staff. So the culture is very based in family. It's very based in helping each other out. So I think the culture here is a little bit different than most. I hear a lot of people that come in say there's something different here. And I think that's the difference with Westview.
Okay. Well, thank you. Thank you so much. I've enjoyed talking to you. Is there anything else you'd like to say before we end the conversation?
No, just thank you for having me, and this was fun. So I appreciate you reaching out and we were able to chat for a little bit. So thank you.
Thank you so much.
All right.
Well, guys, if you enjoyed this video and you'd like to see more like this, then please consider subscribing to my YouTube channel. Thank you for watching and have a great day. Bye-bye.